Now let us talk about lung abscess. First of all, abscess is process of formation of pus which is called suppuration, which is the result of infection, is called as abscess. Abscess is suppuration surrounded by fibrin to in a localized area, is called as abscess. Abscess which forms in the lung is called as lung abscess. Most common cause is streptococcus, pneumococcus, haemophilus staphylococcus, and aerobic bacteria. Bronchial obstruction by foreign body. When a foreign body obstructs the bronchi, result in accumulation of collections and results in the formation of an abscess. Next, chronic respiratory infection like sinusitis, tonsillitis, dental infection, septicemia, and asp procedures like aspiration, which results in the formation of abscess. Actually what happens is collection of suppuration in a fibrin surrounded by a fibrin clot. This fibrin is formed due to the inflammatory reaction of the body. So this infection may cause tension to the surrounding tissue, tension in the surrounding tissue, which may result in spread to the surrounding tissue. First of all, aspiration lung abscess is most common in the apical lobe. Let us look at the clinical features. Clinical features is due to active infection. There is acute fever which is recurrent in nature, cough with expectoration, hemoptysis, foul smelling, be due to rupture of the vessels. The hemoptysis is due to rupture of vessels which are present in the abscess, or the rupture of vessels or exfoliation of the vessels which are present in the abscess result in hemoptysis. Next, chronic illness with debilation and a pleuritic pain in the chest, illness or a pleuritic pain in the chest cavity. Complication are spread to adjacent area. Metastasis may spread to the cerebral hemisphere due to pyemic emboli. Pus formed pyemic emboli is the pus formed emboli which travel through paravertebral veins to the brain, which result in cerebral abscess. Next, hemorrhage due to rupture of vessels in the abscess which result in hemorrhage. And emphyema thoracis, which is the collection of pus in the lungs. Next is investigations. Most common is CT X-ray. Localized opacity, we can see there is localized opacity or in the chest X-ray with the fluid level. This is the picture of lung abscess. This is from internet. Next, bronchoscopy and biopsy to rule out carcinoma, sputum for culture and sensitivity, and for acid fast bacilli to detect the underlying cause like tuberculosis, and cytology. CT scan is also common. Treatment include medical and surgical treatment. Medical treatment include medical treatment is first, as we finish culture and sensitive culture here, the result of that culture will give high dose antibiotics. Most common antibiotics are penicillins and third generation cephalosporins. They are given for 3 to 6 weeks and postural drainage for 2 to 3 hours for 3 times daily. Next, periodic culture for sputum to check the response to the treatment. We can do periodic culture to check the response to treatment. And surgical end stage of this. After finishing this, if medical treatment fail, we'll go to surgical treatment. Surgical treatment is external surgical with rib resection. With the rib resection, we can drain the abscess with the removing of the part of the rib. By removing part of the rib, we can remove the abscess. Next, lobectomy is done if all the treatments fail. Lobectomy, lobectomy is removal of any lobe of the lung which consists of abscess which fail to respond to the medical treatment.